Bldg, the chair of the House Committee on Dangerous Drugs, other members of Congress here present, especially our incoming district governor of that 780, DG Sam Magdalao, the heads and representatives of government agencies and the police. Good morning. We, the advocates of medical marijuana, are very happy and honored to be invited to share our views and advocacy to the very people who can make things happen. We are in good company. I am Chuck Manansala, as mentioned by the chairman. I am the founder of the Medical Cannabis Research Center. I am a core group member of the Philippine Cannabis Compassion Center, and I am a supporter of the Philippines Moms for Marijuana. I am here before you today to seek your support in helping those in need of medicine. I appeal to your compassionate heart to feel the desperate needs of patients who have cannabis as medicine. Marijuana, scientifically, is called cannabis. I refer to children and adults with intractable epilepsy. The Mayo Clinic says that 1 in 5 children with epilepsy has intractable seizures, defined as seizures that fail to respond to at least 2 appropriate anti-seizure medications. Surgery may be an option, but the path to that decision is complex. As seen in the CNN documentary of Dr. Sanjay Gupta titled "With," which you can view in the internet through YouTube, cannabis was able to dramatically reduce the seizure of patient Charlotte PG, a 5-year-old child who had Dravet syndrome. From 300 seizures a week, Charlotte's seizure was reduced to 1 to 2 a month. I refer to patients with cancer who want to avoid the nausea, vomiting, and lack of appetite when undergoing chemotherapy. Or those cancer patients who wish not to take chemotherapy and instead opt to try a treatment mode that can possibly save them from certain death. I also refer to those patients who suffer intense pain from severe injury, multiple sclerosis, arthritis, fibromyalgia, diseases that cause neuropathic pain, and other diseases that result into severe chronic pain. I am one of those. I want to avoid painkillers, especially the non-steroidal anti-inflammatory drugs and muscle relaxants. I want to protect my stomach, my liver, and my kidney, and not to have to reach a point that I will have to undergo dialysis for the rest of my life. Finally, I refer to patients who are afflicted with HIV/AIDS. A lot of them are showing up in reports in the Philippines. They will need cannabis to help improve their quality of life. It will help HIV patients manage appetite loss, wasting, nausea, vomiting, pain, anxiety, stress, depression, and other symptoms of both the disease and the antiretroviral regimes used to treat it. According to the Organization for American for Safe Access, as many as 1 in 4 people living with HIV/AIDS use cannabis for medical purposes. There are other diseases, including glaucoma and metabolic syndrome, to which cannabis may prove to be effective medicine. So I appeal to the Committee on Dangerous Drugs and the Department of Health to help our patients have safe and legal access to cannabis. For this effort, we believe we stand on solid legal and moral ground. The Single Convention on Narcotic Drugs, 1961, as amended by the 1972 Protocol, clearly states in its preamble that, and I quote, "The parties concerned with the health and welfare of mankind recognizes that the medical use of narcotic drugs continues to be indispensable for the relief of pain and suffering, and that adequate provision must be made to ensure the availability of narcotic drugs. Cannabis is included in the definition of this drug." Republic Act number 9165, otherwise known as the Dangerous Drugs Act of 1972, as amended, in Section 2, Declaration of Policy, it stated that The government shall aim to achieve a balance in the National Drug Control Program so that people with legitimate medical needs are not prevented from being treated with adequate amounts of appropriate medications, which include the use of dangerous drugs. In fact, the Secretary of Health, Dr. Enrique Ona, has expressed his thoughts in an interview on TV Patrol broadcasted last January 23. He said, and I quote, "As a doctor, there are situations where marijuana as a medical intervention would be helpful to a patient." Cannabis has been medicine for 5,000 years. It has been recognized as medicine by the United Nations. Our own law recognizes the legitimate medical needs of people to whom appropriate medication include cannabis. So we appeal to the honorable representatives of the people to help those in need of this medication. Help us in the creation of laws and guidelines so people may have safe and legal access to medicine under the guidelines and supervision of the Department of Health and the Dangerous Drugs Board and the Philippine Drug Enforcement Agency. Together we can come up with effective measures to make cannabis available as herbal medicine and pharmaceutical preparations. Together we can come up with the necessary control, licensing, and mechanism in the growing, cultivation, preparation, and dispensing of the cannabis whole plant as medicine as well as pharmaceutical preparations under the prescription of licensed and trained medical doctors. I can understand the hesitance and doubts of some on recognizing cannabis as medicine. The stigma on marijuana has long been perpetuated by those who profit from the drug war. My final appeal to the committee is this. Let us approach the issue of cannabis from the standpoint of science, compassion, health, and human rights. Given today's state of scientific and medical knowledge, I submit that preventing the medical use of marijuana is legally, scientifically, and morally wrong. I hope you can appreciate that the issue of cannabis as medicine is literally a matter of life and death. Since the campaign was started publicly last year by parents June and Micah Yuto for their child Moon Jaden, 4 children have already died of intractable epilepsy, including baby Moon Jaden. There are still children to be saved. Some of the moms of the children are here with us today. Donabel,
Shells.
and Shells, and
Cecil.
So, Cecil, and their children are suffering, and they have tried all types of medications. It doesn't work. The seizure is still there. The only hope right now is cannabis. We are not sure if it will work, but we cannot know until we try. There is a scheduled policy.
There's no bill yet passed.
No, there is a policy forum.
Presentation.
There is a policy forum on medical cannabis on February 27, and this is an opportunity to dig deep into the issue, for which we thank Congressman Rod Albano for initiating this forum and for filing and the efforts to file the bill. And I hope you can all join us. I have no doubt that together we can make things right. Thank you very much.